You're listening to Body by Poly. I'm Dr. Alain Polynice, and this podcast is for anyone considering surgery and navigating all the complicated decisions to make before, after, or somewhere in between. Let's talk about what really matters. On today's episode, we're going to talk about a very important topic that can have a huge impact on post-op results after plastic surgery, and that's the question of post-op recovery and what to do and what not to do after surgery. So the first and most important thing is just really follow the recommendations of your surgeon, because in my case, in my practice, I give patients very detailed lists of instructions of what to do and what not to do. So in the first week after surgery, the key thing is rest and recovery. You have to remember that you had a big surgery. It's a huge impact on the body, not just from the surgical point of view, but from anesthesia point of view. So you are really recovering, and it's important to rest, stay hydrated, take your medication as prescribed, and not overdo it. Especially in my case, when I operate on patients and I do big mommy makeovers or big surgeries, I use something called Exparel. Now, that's something that I inject at the time of the surgery. It's basically a long-lasting, slow-release local anesthetic, and it really helps take the edge off, take the pain away, not completely, but enough so that patients have a much more comfortable recovery. The problem is that pain is there for a reason, so it helps people know that something happened and not overdo it. So if the pain's not there, you still have to remember that you had a major surgery and it's important to take it easy. After that first week, most people are feeling much better and they can resume their normal activities. But then we're going to get into the phase of managing swelling and managing the scars. So that's where we're going to use things like arnica for swelling, different lotions that patients use for massaging, and also getting a professional massage is very important. And we work with somebody wonderful who really starts with lymphatic drainage type of massage, leading up to a more deep tissue, full body massage, and that really helps the swelling go down much faster. As far as the scar is concerned, that's also very important. First, you're going to start to manage the scar with massaging, but then also use silicone gel or silicone tape, which helps the scar mature much faster and fade and turn into a fine line that's almost imperceptible, usually by 3 to 6 months. So there are a lot of things that you can do to really help the process along, and it's important to follow those steps, follow the guidelines that your surgeon has set, because it can make a huge difference in post-op recovery and in the ultimate results. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.